It speaks volumes about us. No pun intended with volume. So many of us, maybe you're saying to yourself, you know what, Amy, I've got sensitivity, I've got staining, I don't know what to do. I'm using this toothpaste brightens, this has optic whiteners, this toothpaste. We're gonna stop it all for you. Intelliwhite's a #1 whitening system. #1. That's saying a lot. Dr. Jennifer Joblo has been written up by all the major magazines. She's been dubbed as the Tooth Fairy. She's the reason why so many talk show hosts and celebrities have perfect white smile. This is her Supersize Smile Saver Toothbrush and toothpaste. This is 8 ounces. We usually sell 4 ounces for what, about, I think it's about $21. We doubled it up and we're giving you the charcoal toothbrush. It's our weekly deal drop. It's an 8-month supply for $21.95. We sell 4 ounces for $21. We're gonna give you 8 ounces for the same price. I have got to stress for all of you right now who have sensitive teeth, and you're saying, why do my teeth so sensitive? We lose those minerals, let's put those minerals back in. This costs pennies per month. Pennies. Dr. Jennifer Joblo is joining us live this evening for our weekly deal drop. 8-month supply. It's like,
I know, it's crazy.
$2 and change a month. We're putting the minerals back in, vitamin E. I'll let you tell everybody. You know how much I love your Cocoa Bright and how much I love your toothpaste.
Okay, so this is for everybody. It's fluoride free, so even your children can use this. This is the toothpaste that does it all. We're putting the minerals back into your teeth. Why do you want to do that? From everyday wear, whatever you eat, you drink, soda, sports drinks, whatever, that's actually pulling the minerals out of your teeth, the calcium, the phosphate. This has what's called nano hydroxyapatite. This is the gold standard used in Japan for the past 40 years, and now it's the gold standard here to replace fluoride if you don't want to use fluoride and go more natural. This actually fills in the little pits in your teeth, those microscopic pits that you can't see, but you're feeling. You're feeling sensitive to eating something or drinking something hot or cold. You're feeling some weakness in your teeth. The reason why you get cavities is not because of the sugars or the sweets. Yes, you should be not overloading on that. It's because we lose the minerals in the teeth. This has 8 months worth. It also has vitamin D. Vitamin D takes the calcium and puts it into the teeth. And I also want you to Google, because I can't tell you here on air, what does vitamin D do for your gums? It does something very good for your gums as well. We have our patented stain removal ingredients, so your teeth are going to appear brighter and glossier and have more reflection to them. Your teeth are going to feel so good. And zinc. Why zinc? Because zinc ions actually kill bad breath at the source. So you're going to wake up with fresher breath. You're not going to have stinky breath all day. You're just going to need a tiny little drop. Let me show you on this toothbrush here. This is all you're using. An 8-month supply for a professional treatment. This isn't just a toothpaste. This is a treatment, because what this is doing is actually putting the same minerals that make up your teeth back into your teeth. So when you're brushing with this, I don't want you rinsing it out. You can spit out the excess, but please do not rinse it out. I want those minerals to hang around and saturate in your teeth, because like your skin have pores, as we get older or as we're eating and drinking more acidic things, the pores in your teeth get bigger, and that's where you start to get the problems. You also get more staining, you get more discomfort, you get more problems. This is like a tooth that has the pits or the pores open. Obviously, we can't see that with the naked eye, but then we take the minerals and we put it right back into the surface. What does that do? It protects it from staining. It protects it from discomfort. And also, when you think about it, if everything is smooth like this glass and all the pits are filled in, the stains are just gonna roll off. The coffee, if I poured it on here, would roll off. Your teeth are gonna be more reflective. When my patients come to me in my office and they have discomfort or they have problems with staining or any type of problems, what do? I do a nano hydroxyapatite treatment. You know how much that treatment costs each time per tooth? $100. Wow. For you, for $270 a month for 8 months. And this has a 3-year shelf life, so buy multiples because we don't have this on auto ship. And this is our last super size of the year. We're putting these minerals back into your teeth. There's nothing in the drugstore that can do that.
Yep. There's no auto ship on this. So again, this is all the only toothpaste that I use. So many of us as hosts, the same thing. And right now, there are toothpastes out there. They're this sensitive. They're this designed for sensitive teeth. They're putting, you know, do you know what those are? $9 and $12 for one tube. okay? And you're buying 2 of those a month. There's like, what, 3 ounces in there. This is 8 ounces. You're also going to receive the toothbrush. Once you brush your teeth, it's minty. Your teeth are automatically whiter and brighter. It's putting back all of those minerals on your teeth so you have less sensitivity. Read about what vitamin E does for all of your gums and the tissue around your gums. It's remarkable what she put in this toothpaste. And again, it's only for this week at $21.95. This is the 4-ounce size. We sell that for $21. This is 8 ounces, and we're also gonna give you the Intelliwhite charcoal toothbrush. So again, if you've ever considered going and having maybe that procedure done, because right now you're dealing with a lot of sensitivity, and as we age, it's just natural. We start to lose the minerals in our teeth. When you put them back, you're creating a stronger enamel. That's the most important thing that we have to protect our teeth is our enamel. As we age, we lose it, and that's just wear and tear. Let's put those minerals back in. It's our weekly deal drop. Do you see how fast these are selling? And this is it for the entire year. No auto ship, nothing. All those enamel toothpaste that are out there, they're like $11 for like 3 ounces. And you're buying 2 or 3 of those a month. This works out to be $2.75. Yeah.
Right, and Amy, they don't have this technology. This technology is the same technology that NASA uses because when their astronauts go up into space, their teeth lose minerals, just like our bones lose minerals. That's how things get weaker. This is the same technology. And we haven't even spoken about this free toothbrush that you're getting. Look at it. It's so different than any other toothbrush. It's silky, but what's important about it, it has 12,000 brushing filaments in here, okay? So a regular toothbrush only has about 120 filaments. It's also super soft. It's infused with carbon, which is an antibacterial, and it also helps with stain because it traps the stain. So you're getting that as a free gift. You're getting this jumbo-sized toothpaste. And remember, this is our last super size of the toothpaste of the year. Not on auto ship, because if you afford to buy multiples, I would. 3-year shelf life, fluoride free. The best alternative to fluoride is the nano hydroxyapatite. It's what NASA uses for their astronauts when they come back and their bones are weak and their teeth are weak. It puts the minerals back into the teeth. Why do we do that? Because when you eat, you drink acid or anything, it's pulling the minerals out of your teeth. And that's what's causing the problems in your mouth. That's what's causing increased staining. That's what's causing increased discomfort to hot and cold. As we age, also our gums start to pull away. So what do we need to do? We need to actually put more minerals up into those teeth to cover those areas too. I can't tell you what vitamin D does, but please Google, okay, and see what vitamin D does for your gum tissue, because that's important. And zinc also for fresh breath all day long. So we've done everything with this toothpaste.
You have, can we just show Sonia? Look how white her teeth are. Let's just pause for a moment. And yes, Sonia's gorgeous. But look at how white her teeth are. I know, Sonia, this is all you use is the Intelliwhite. You don't whiten that often, do you? No, here's my whole point on this. I wanted to show her smile after she's done brushing her teeth, because when you deposit those minerals back in, you are instantly whitening your smile, like on contact. I haven't whitened, and usually, like, I would whiten maybe, I don't know, every other month. It's probably been 4 months since I've whitened. I don't have to whiten because this is the toothpaste I use. I'm depositing that minerals, that calcium, all that back in, and it's giving you that white back instantly. I'm also protecting against future staining. So again, when you put all that calcium, all those minerals back in, and the vitamin E, read about that, it's the biggest game changer. So if you've got sensitivity and all these issues, and you're spending a lot of money on those enamel toothpastes, and you're buying them over and over again, like every other week, because they only sell them in 2 or 3 ounces, this is 8 ounces. We're gonna show you again and why this is so popular. It's about a minute or sellout, and no auto ship. A lot of you ordering more than one, because if purchased separately, just the 8 ounces by itself is $41.90. Then the charcoal plush toothbrush, which is amazing, that's almost another $10. So you have to brush your teeth anyway, right? Why not do it the most effective way possible, where you're not only getting a whiter, brighter smile, but you're also protecting your teeth and putting back in your teeth what your teeth are losing as we age, whether it's from the sodas, the wines, or the combination of everything, right? We're hydrating our teeth as well. It's very important. So again, if you want to get this, we have a lot of you ordering, almost 500-600 of you ordering it. This is the easiest way to have a younger looking smile. And what I love, doctor, is I'm not spending $20 or $30 every month. I'm spending $2 and change a month.
$2.70. And those drugstore toothpaste are actually stripping the minerals out of your teeth with all those harsh abrasives, all those yucky ingredients, the saccharin, the parabens, the dyes, the phthalates. You don't want that. You want to put the minerals back into your teeth. This is actually creating like a glass coating, like an armor. And then your teeth become more resistant to stain. They become shinier. They reflect the light better. Your whitening's going to work better, and your whitening's going to last longer. And you're going to be more comfortable to eating and drinking hot and cold because we're creating a protective layer. Those drugstore toothpaste that cost you more per month, those are not treatments. This is a treatment. So please, I must tell you, do not rinse your mouth out. Just spit out the excess, because I want all those minerals to saturate and hang around. And that vitamin D is very important for your gum tissue. Please go on Google and take a look and see why, because it's super important as well.
And you know what else I love? It's minty. It's fresh. So again, if you want to pick it up, look how fast these are selling. We're selling 5, 3, 10 at a time. This is it. Pick it up. It's $7 and change. It's the best investment on your smile, which is your biggest and best accessory. So thank you, Dr. Jennifer Jodlo. We just adore you.
So
thank
good to
you.
See you.
Nice
Love
seeing you. Take good care.
Bye.
You look gorgeous as always. All right, we do want to let you know, we've got a lot more to get to. Katarina's here. How are you? You look beautiful.